Well, taking you beyond the headlines, the ABC 15 Health Insider is all about getting in-depth expertise on the very latest medical news. Valley doctors and nurses joining our team to help you make the most informed decisions for your entire family. All week, we've been collecting your questions about the COVID vaccine, and our Nohelani Graf is getting those answers.
Some of the most common questions that we've been getting are about scheduling and who can sign up. So let's start there. The CDC is recommending including those 65 and older. That's who state-run sites will accept. We're talking State Farm Stadium and Phoenix Municipal, as well as teachers, healthcare workers, and first responders. County sites will vary based on vaccine availability. State sites will also sign you up for the second shot while you're still in the observation area. County pod sites may email you.
At anyone before January 20th, it looks like they've sent out about 45,000 emails getting people scheduled for their second shot. And as more appointments become available, they will be emailing.
Jan from Chandler asked how long the first vaccine will work if she doesn't get the second round within the 3-week window.
If there is a delay between the first and the second, that there is no need to restart and go back and get revaccinated.
And a question from Connie. Is there any research showing a high death rate of elderly after the second shot?
We're close to or surpassing 100 million vaccines delivered worldwide. If this was an actual trend or correlation related to the vaccine, we would have seen it by now.
Dr. Payush Gupta sharing a metaphor to help us understand how you can still be a carrier of the virus even after getting vaccinated.
Think of the vaccine as a security guard somewhere in the building. It's about to catch an intruder if an intruder enters the building, versus a security guard that's standing at the front door of the building and not letting anyone in. We know that the vaccines are very effective if an intruder enters the building and catching them. But what we don't know is how effective the security guard is at the front door.
Which leaves people like Brian from Sun City wondering when they can safely travel and visit family after being vaccinated. We know the second shot starts to work 2 weeks after getting it. Dr. Gupta says you still have to weigh the pros and cons.
Still high case rates, there's still high death rates. Continue masking up, continue social distancing.
Esther asks if someone recovering from COVID should wait 90 days to get vaccinated.
People that have had documented COVID-19 in the last 90 days may delay vaccination till the end of the period, but there's no contraindication, as the chances for reinfection by a similar strain in that time period are actually really rare.
But he adds you should not get the vaccine until you have recovered from COVID and have been cleared by your doctor. Other fast facts from our experts. The first and second dose are the same shot, same components. You do need to stay consistent with Pfizer or Moderna. If you're asked for your Medicare card, they will cover the cost. And if you suffer from food, bee, or pollen allergies, the vaccine is still safe, but that's also why there's an observation area set up at vaccination sites. One of our health insiders leaves you with some perspective. This is essentially the largest clinical trial ever done, with vaccines being administered live. So more answers will come. And when they do, we'll get them to you. For ABC 15 Arizona, I'm Nohelani Graf.
And if you have a question or a story that you want our Health Insider team to look into, just email your ideas and your questions to healthinsider@abc15.com. Well,